May is Mental Health Month, and my name is Courtney. I'm the brand ambassador for the Visiting Nurse Association of Ohio, and I am so excited to have this discussion today with our mental health experts. We have Amy Silva and Tara Brown. Ladies, before we get started on today's discussion about mood disorders, I would like each of you to give us just a little bit of background information about yourselves. Amy, we'll start with you.
My name is Amy Silva. I'm a certified psychiatric nurse and the director of the mental health program at the Visiting Nurse Association. I've been with VNAO since 2002 in various roles. Been a nurse since 1999. I went to University of Cincinnati, go Bearcats. Started off as a mental health nurse in the field. I did that for about 4 years. Then I became the manager of the program for 11 years. And then I've moved into sort of a directorship business development type role now. I'm also continue to see patients in the field to keep my skills up, and I just love to see patients and interact with them. So that's me.
Miss Tara.
Hi, my name's Tara Brown. I'm the clinical manager for the mental health department at VNA. Got my first undergrad in 1998, which was in criminal justice and forensic psychology. Worked in the criminal justice field in corrections, a deputy, juvenile probation for about 12 years, had enough, and went back to nursing school, graduated from Cleveland State's accelerated program in 2016. I worked in an inpatient setting for about 3 years to work on my skill set before going into home care. I've always liked being in the community with my background. So I knew I wanted to work for the VNA. I just needed to work on my skill set first. So been with the VNA for 2 years, still out in the field like Amy, and I just started my nurse practitioner program at Duquesne.
I appreciate you ladies for taking the time to do this for us today. I'm excited for everyone to learn more about our program and mood disorders. Mood disorders. That's something here. Maybe it's a phrase or a term that people haven't heard. Can you guys give us a general explanation of what a mood disorder is? Amy?
A mood disorder is a broad term for a spectrum of different illnesses. Depression would fall under this. Adjustment disorder, in a new situation or something significant happens to you, there's a death, there's a trauma, you're moving into a new situation and you're just having a hard time adjusting. So it's really anything related to your mood, like seasonal affective disorder, where you get sad in the wintertime, but it basically deals with depression and different mood fluctuations and your adjustment to situations that can cause you to be depressed or anxious, or it affects your daily functioning. You can't function like you used to because your mood is not right.
So it sounds like mood disorders is the broad term for everything that can be categorized into something that affects the way somebody might think, feel, or act. Do I have that correct?
That's correct.
Tara, do you have anything that you'd like to add?
It's almost as if you're on an emotional roller coaster. It's a very emotional type disorder. People just always say sad to happy, but there's the anxiety, the depression. I can't handle coping with these emotions to, do I take my own life? So it's just a huge bundle of emotions that the patient is not able to cope with. And it does affect working or daily grooming or eating, sleeping. Your basic needs cannot be met.
Amy mentioned that external factors can cause mood disorders.
Sure. External circumstances can cause mood disorders, loss of job, which we've seen that recently. Many people losing jobs, getting evicted from homes and having to move or not having a place to stay. Grieving can be coincided in that, that emotional roller coaster of grieving. But there's also internal factors. It can be a family history of it, and it can be genetically passed down from generation to generation. Postpartum depression, menopause, things like that will cause some sort of mood disorder. And then a traumatic experience. Not that losing your house and losing your job is traumatic, but we see this with a lot of vets with post-traumatic stress disorder, but we also see it in victims of violent crimes, rape, domestic violence. You see this cycle a lot.
I just want to point out that environment is a really important factor. in mood disorder development as well. Anxiety is contagious. Depression is contagious. If you're living with someone or you're raised by someone or there's someone in your family who is important to you that has a mood disorder, it can affect you negatively because you think that's normal behavior. You think that's a normal way to be, and that becomes your normal. If you're around alcohol, drugs, abuse, spousal discord, anything like that, you may not have necessarily a chemical imbalance in your brain like you do when you're born with depression, or you just have there's a imbalance in your brain, but you have an environmental factor that is causing you to be depressed.
Is there a difference between a mood disorder and a personality disorder?
Absolutely. Personality disorder is a flaw in your character itself, your personality. It's not your mood. There are several different personality disorders, and the most well-known is borderline personality disorder. So that usually stems from some kind of severe sexual trauma in childhood. And as the person grows up, they usually have a very unstable sort of family situation, and there's just a lot of chaos and drama. As they turn into adults, they try to cause chaos, drama, discord wherever they go. They self-sabotage,
Attention seeking.
will attempt suicide, attention-seeking behaviors, because they're so wounded inside that they just constantly need attention and they need to focus on them. And that's a flaw in their personality.
The borderlines, when we say the attention seeking, what we mean is either positive or negative. We see a lot of cutting to release all that build up anxiety or anger, what they have inside of them, but they're also doing it to seek attention. Another big one, antisocial personality. So like with borderlines, you'll see a lot of actors, actresses, musicians. You'll see a lot of that can also start at a very young age. If they're setting fire to things, or bedwetting still at 5, 6, 7 years old, or hurting animals at a very young age just to experiment, and then they move on. So you'll see a lot of criminals who have these tendencies, and that's what we use as red flags to identify. Like when I worked juvenile probation, those were key factors we asked. A mood disorder, there's multiple different types of treatments for them that can help not cure it, but stabilize it so they can live a productive life. However, with a personality disorder, unfortunately, there's no set treatment for that. They just have to learn how to cope with them. There's nothing that can treat the personality itself.
Right.
We can treat the behaviors, but not the personality itself.
Psychiatric medication is usually not effective, and that's how we tease out a mood disorder from a personality disorder. Does it improve with medication, or does it kind of stay the same or get worse? Social media and any kind of media really can have such a detrimental effect on your mental health. If we just look at watching the news in the past 14 months, I had to stop watching it because every time I watched the news, it made me sad, not only about my own life, but the state of the world. I have a 5-year-old daughter. What have I brought her into? I felt horribly guilty about that. And then when you're constantly exposed to it, hour after hour, day after day after day, it's going to wear on you. And actually, they're doing research, people who chronically expose themselves to social media and negative social media, and they're comparing it to PTSD. It's a kind of a form of that. And that's something that's emerging out of this COVID epidemic, that those feelings need to be addressed, and quickly, because otherwise they're leading to suicidal thoughts, suicide attempts, completed suicides, and a lot of other issues in the person's life.
Especially during this time when, for some of us, our only form of connectivity is through social media. There is no end to it. There is no turning it off. It's always at your fingertips 24/7.
If there's one piece of advice I could give to the post-COVID-19, I mean, things are getting better, but it would be to limit your exposure to social media and media in general, news outlets, stuff like that. Focus on spending time with your family, or virtual chats, or Zoom, or whatever, face-to-face with people, not face-to-face with negativity all day long.
One day at a time, but everybody needs to really take time for themselves and do a self-inventory of, what do I enjoy doing? Not just, oh, I'm going to do this to take my mind, but what do I really enjoy doing? Like, is it working out? Is it knitting? Is it reading? Is it just sitting outside now since it's getting warm and just watching the birds? I mean, just take that time for yourself, because otherwise, if you don't, long-term effects, it's not just that, your anxiety, and your stress is going to be high, but that also impacts your relationships with family, friends. It impacts your sleep. It impacts and your overall productivity, period. If you don't take time for yourself, that productivity in your work, is it really going to be genuine, or is it just going to be rushed to get through another hurdle to get to the next one? If I'm going to do something, I want to do it right, and I want to learn something from it. I'm not going to just breeze through something to say I finished it, because then what do I have to show for it? But really, take the time, and I know that's easier said than done, but I know if I can do it, everybody else can do it.
That's a very true statement. You never stop.
I have depression myself. I'm not shy about it. I've been dealing with it for years, and it was from a traumatic experience. But I know it took me a real long time to come to where I'm at now. I mean, probably 10 plus years. But I've learned from it. I've grown from it. I know when I'm, hey, I might be having a down day around this time, but you know what? I know that, and I know how to cope with it. And yeah, I need medicine, and it is what it is. I'm not shy to say that, because I'm still functioning. It shouldn't be taboo. And, I'm not going to be a productive person, or I'm a bad person. No, I'm still productive, and it's worth it.
Thank you for sharing that, Tara. And 1 in 5 people in the United States has a mental illness. That's 20% of the population. So chances are, if you don't have it yourself, you know somebody that does, or your life has been touched in some kind of way. It's very common. It's one of the most common illnesses you can have. And it's biologically based for the most part. It is a disease just like diabetes or heart disease or anything like that. But do we talk about it like that? No, we do not. Does it get the attention and the funding that it needs? No, it does not. No, we all live in the world. We all have stuff happen to us. There is no normal. What you're feeling is what you're feeling. And it's valid. Don't minimize it. Don't be like, well, I'm just stressed out, or I didn't get enough sleep last night, or me and my husband had a fight and I'm just angry. Pay attention to what you're feeling. Don't feel like if you're not feeling right that you're different, or that you're in it alone, or that something is wrong with you. You're having a problem. We all have problems, and they're only going to get worse, and they're going to fester if we don't talk about it. And it doesn't necessarily mean that you need medication. There are other modalities that can be used to treat a host of mental illness, but sometimes medication is the answer. Usually any psychiatric medication, especially antidepressants, take about 4 to 6 weeks to kick in. So that is a frustration for a lot of people, because it does take a minute to kick in. But once it does, at least from my clinical practice, the positive effects of that I have seen are tremendous.
It's okay to say, no, I'm not okay today. I'm not. It's like, why is that not acceptable? Again, there we go with, you're lying to yourself and you're lying to others. And then that might fester and feel guilty, and be honest with yourself. You have to, and it's okay.
There can also be mood disorders that are induced by a medical condition. So if your thyroid is off, you can get really depressed. If you're on steroids, you can get what's called steroid mania, where you just can't sit still and your mind's going, you can't sleep, you might make some poor decisions and do some risky behaviors that you might not have done. And when you stop the steroid, all that goes away. So it's a medical issue. Also, there's something called dysthymia. And when I think of dysthymia, I think of Charlie Brown. So that's a chronic low-level depression all the time. You're never really great. You're never really bad. Things tend not to go your way, but you kind of shake it off and you keep like Charlie Brown. But that's a mental illness, and that's something that can be treated. That does not have to be your day-to-day existence. And there are also mood disorders that are caused by substance use. So using the substance has caused you to become, have manic symptoms, or have depressive symptoms, or have thoughts that are disorganized, or paranoia, or something like that.
Alcohol is a depressant in and of itself.
And this is how problems can start.
Sometimes it starts just in the home. They see mom and dad do it to cope with their stress levels. So guess what? I'm going to do it too.
It can truly happen to anyone.
Yeah, I'm real anxious to see the rate of inpatient stays once people have things open up and have to go back to work, especially with detoxing. More people are drinking at home while they're working from home. But what happens when they have to go back to work?
An adaptive coping mechanism at the beginning can become a maladaptive coping mechanism very quickly, especially when you're isolated and alone. And I think there's an interesting cultural shift that I've seen going on. It's more accepted to joke about excessive drinking because of COVID and a way to cope. You see commercials on TV constantly in my feed on social media. There's wine glasses you can order, or a shirt that's like wine o'clock, or like, all these different kind of things that I didn't see as much of beforehand, or it was usually tied to like a bachelorette party or something like that. But this is something that's tied more to our daily life, and it's become almost a social norm in a way for a lot of us, and very acceptable, and not, binge drinking, which it could be, or, leading into some alcoholism or problems with that. We need to find other ways to cope. And Tara's right about the going back to work. It's an adjustment for all of us, but if you have been consistently drinking or smoking weed or whatever you've been doing, it's going to be a big adjustment for you to go back into that environment where you can't do that.
When is it time to seek help in any diagnosis?
I can give you a good example. One of the mood disorders that we didn't bring up that I just wanted to touch briefly upon is premenstrual dysphoric disorder. And as women, I think a lot of us just explain that off. I have PMS, I'm on my period, I'm hormonal, this is just something I have to deal with. But if it's happening month after month and it's starting like 10 days, 14 days before your cycle, and you're just getting worse and worse, and it keeps happening and it's affecting the quality of your life, you may not want to get out of bed. You may not want to cook. You may not want to take a shower. This is not something you have to deal with. So this disorder, this premenstrual dysphoric disorder, is a good example of that. So if that keeps going on month after month, you need to talk to your gynecologist first, and they might recommend that you see a psychologist or a psychiatrist or a psychologist to kind of deal with that. That's not something that you have to go through. That's not normal. If it's continuous, if it's worsening, if you're missing work, if you're having really dark thoughts, maybe I can't take this anymore. I don't want to be alive. If this is how I'm feeling, I'm done. Those are all, or if you isolate, that's the other thing. You kind of take yourself out of the world. You just want to be by yourself. You don't want to talk to anybody. You don't want anybody to talk to you.
Those are not normal thoughts, and they're not normal ways to live. And it's okay to acknowledge that, because there's no such thing as normal, but it's nothing that anybody has to put up with.
Mm-hmm. And
we put up with a lot that we shouldn't.
Yeah. If you're the loved one of somebody that's having these feelings, you just need to support them through this, but forcing them to go seek help is not the answer. They have to do it on their terms. If you force them, that could go really bad really quick. There could be retaliation against you. That relationship could then disintegrate and be done. But you need to be just there and supportive and listen therapeutically. Listen, not just hear what they're saying, but listen, and try to understand where their head's at. I know because I myself have been in a couple bad relationships where my partner did not listen. Like, oh, you're just sad, get over it. No, it's a little bit more than that. He just did not understand it. So
And that's the unfortunate stigma, I think, surrounding mental health.
There's plenty of things that we could, things not to say. Snap out of it, just get over it. It'll get better, I promise. Take a nap, you'll feel better when you wake up. Just have a beer and you'll feel better when you wake up. This is something that is not going to go away. These are not helpful comments to make. you don't want to call the person crazy or just what's wrong with you. But just, I don't understand what's going on. Why can't you just
Snap out of it.
Or why can't you?
Yeah.
We hear that a lot. And that depression or any of these mood disorders is not something that you can snap out of.
Mhm.
And I think the best way you can support your loved one who may be experiencing a mental illness is to listen and to hear them.
Just in general, what is their definition of happy? If they're a drawer, draw happy for me. Content, what does contentment mean to you? Satisfaction with life, or work or school or whatever it may be. What is it in their words? Because then you can take that context. Okay, how do we get this happy for you? How do we get this content life for you? How do we get there?
Mm-hmm.
Thinking outside the box and using tools that we can take from our professionals and apply it to the people that we know best.
Right. And it's very important to not push your own agenda on the person.
Mhm.
Yes, you want to help. You are coming from a very good place. But there's an important term in psychiatry that I remind myself of all the time is meet the patient where they're at. It's not
Right.
about you. It's about them. The questions you may ask or the things that you're trying to do may help you feel better inside, but it's not going to make that person feel better. So a lot of times I'll ask patients, do you remember the last time you were happy? And what was going on in your life? What were you doing? What winds your clock? Like Tara was saying. But can you even remember? I mean, if they can't remember the last time they were happy or content or fulfilled or satisfied in their life, I mean, that's a huge problem, right? It tells you a lot about the person. It's been going on for a long time. They have a lot of strength, obviously, to get through day after day after day, but they're used to it. And when we're used to something and we're afraid of change, we don't want to go into the unknown. We don't want to do what we are afraid of, especially when you're depressed or anxious or anything. So just meet them where they're at. Try to just ask them questions and not push your own agenda and not do things for them that they can do for themselves.
And then I typically have asked too, like, just what if they had 3 wishes, anything at all, what would it be? And that kind of opens the door. Like, is it material things? Is it a physical ailment that they, are thinking of? That kind of opens the door to let you kind of understand where their heads and what they're focused on right now. So, and it also tells you that these are wishes. So in their mindset, they almost don't believe that they would ever get there because it's a wish. I mean, so that kind of opens a doorway.
Treatment works, people recover. It's not an untreatable illness. Most people can do either some kind of treatment modality, medication, therapy, counseling. I mean, there's a bunch of different things and they can get better. And I think a lot of people don't believe that. And I think a lot of people are afraid of the psychiatric medications. We have come a long way with medications for depression and anxiety and schizophrenia and the antipsychotics. I think people are very afraid of those. And there are a bunch of new ones that have a very low side effect profile, and they're safe. Antidepressants are relatively safe, and anxiety drugs, benzodiazepines, they are a controlled substance. We try to avoid that, but for the most part, these medications are safe and effective. But you need ongoing follow-up to make sure that you're doing okay, and that if problems do arise, that we can address them.
Do you recommend patients seeking second opinions?
I would say, I think a lot of people talk to their PCP about depression, anxiety, mental health concerns that they're having. Please don't do that. I mean, you can. I'm not going to discourage anyone from doing that, but they are not an expert at mental illness. So they're going to throw Lexapro at you because that's the best practice. They're not a mental health professional. They don't know the meds as well. You need to see a psychiatrist and just ask for a referral. And just, even if you just go one time and just get everything out and you never go back again. It's really important to go to an expert, and not because there's less stigma, or you're less anxious to talk to the person, talk to your PCP, because it's really not the best course of action if you want to feel better. Like with the person the first time, find somebody else.
Yes.
And that's true with psychiatry. That's true with counseling. Just because you got referred to a person, if they're not listening, you feel like they're not listening to you, you're not clicking with them, or they're not giving you effective advice. I think especially with counseling, it takes a while to sometimes find the right person who's a good fit for you, who gets you, and who's able to offer the feedback that you need to change your life.
Absolutely.
Or feel better.
We've received a lot of great advice here today. Anybody that has any questions?
Yeah, I just have one. I hope, can you hear me well? I had a hard time getting in.
Yes.
Can you hear? Okay, great. So the question I have is kind of more business-like question. With the COVID rolling, coming to some kind of a conclusion, and our duty to go into the home and take care of patients, are we doing anything in addition to what we did in the past to screen for mental illness or to provide that support to patients who come to us for candidly other reasons?
Well, I think it's opened up a whole new area of assessment for us. I know we've added questions to our assessment, the charting that we have to do. And I do a lot of referrals from hospitals. So what I'm seeing in the hospital is COVID-related suicide attempts, and they have gone way up. So knowing that, and just knowing kind of what's surrounding the person at the time they tried to hurt themselves or kill themselves, opens a whole new avenue of conversation. And I think it's still very, even though it's been going on for 14 months, it's very new to us. And we're still trying to navigate. And there's also the whole issue of the constant trauma that nurses are going to these homes, and they're experiencing their own mental health issues and burnout. So it's compounding our ability to effectively care for people.
Yeah, so let's go back to patients for a minute. I'll be very specific. Would it be appropriate to have a care path for this assessment, this kind of inquiry, so that it's regular and done as effectively as you could? That's number one. I don't know that I don't know it is being done or not. I think coming off of this, clearly everybody's saying we're going to see much more mental health issues that come forward. Probably were there before. But, what are we going to do as an organization to address that? That's the simple question. And, I don't think it has to be an embedded process, or my sense is it won't work, okay? Or it'll go away because people are busy. And their instinct when they go and see a patient is always pretty good. That's my judgment. They know right away, kind of. But nevertheless, this is a different time we're entering into, something we've never experienced. Is coming off of something like this, so we might not be able to see some of the indications that would be, available. That's number one. And then number two is there, from a referral point of view, personal opinion, not medically based, I think it ought to be aggressive, okay? And do we have services, psychiatrists that can do it like we're talking right now through telehealth? Because I think that is so much more convenient than going to an office and blah, 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 blah. It's all, should that be part of what we call the new norm? I hate when everybody says go back to the norm. The norm wasn't so good in some cases. So let's not kid ourselves, So we ought to aim a little higher than what it was. This is probably an example of that. Should we aim a little higher, a little differently? And how's the organization going to deal with that? And I don't know who can answer that question, but I raise it. That's why I got on the call, because it's really concerning me that we need to be really vigilant in all places that care is taking place. Candidly, I think emergency rooms ought to do something differently around this than only ask you, are you afraid to be home or something like that? Somebody gonna whack you at home question. Particularly for anybody that's had the disease, I have had and do have acquaintances and good friends that the disease caused a recurrence of mental health problem that they had resolved, or that they had been taken care of well, put it that way. And they're definitely going backwards right now because of the isolation. I think probably other things, medicine, the effect of the disease, which we really don't know yet. And so my large question is the organization doing something very different and very much a different process because of what we're dealing with in our community and our duty to folks we serve? On the table, that's all.
Yes, I think that it's very important, but it's also ever evolving. So I think while we've had talks about this, we don't have anything standardized yet. I think we're headed in the right direction. I think we have the right mindset for it, and the goal is to help, you know, people with post-COVID stress and all that good stuff. And what you mentioned is the perfect example of an adjustment disorder. You were doing well before COVID, you got COVID, and now you're not doing so hot. And I think that's a lot of people. So how do we do a better job at A, recognizing it, B, assessing what we do recognize, and then C, getting people the treatment they need to feel better. So those are all things that as nurses and as an organization that we're going to look at. We need to develop new algorithms or treatment protocols or literature, you know, to give out to people to help deal with things. That's going to take a little time, but we're headed in that direction, absolutely.
Yeah, well, don't let perfect be the enemy of anything, of any help, okay? My sense is, quite frankly, my sense is the organization, which has been very busy and quite frankly, very brave. All of you going into homes is just remarkable to me. But we all knew this was coming. And looking backwards in the rearview mirror doesn't help anything. What are we going to do now about it? What are we going to put into effect, you know, no offense, tomorrow to take better care of our patients? And then, you know, adapt it to our organization and the literature, intelligence, et cetera, that's going to happen from this, because this is
I love that you're asking these questions. My name is Courtney.
Hi, Courtney. How are you?
Great, nice to meet you. Thank you for joining us. I have had the absolute pleasure of speaking with everybody in mental health on their different roles and principles. So when I have had the conversations with Tara, it's about the medical treatment advancement, and it's very specific to the staff and what they're doing to not only improve their own education, but how they can be better for the patients and identifying patients throughout the rest of the organization in other departments that can also be eligible for our mental health program. And so we're helping not just the mental health program, but exposing the rest of our home health, hospice, occupational therapy, you name it, anybody, so they know what signs to look for in order to be able to offer our mental health services to them. When I talk to Amy, it's not only about the clinical aspect of how we're going to help and do better and be better, being at the forefront of this, but it's also about business development and growing and making our services available to those who are not inside already within our company, and how we can be progressive and better about treating the people that are within our care and will soon be. And I would love maybe some time for us to get together and have a real, you know, a detailed conversation about it, because I'm really excited. My role here at VNA is to be a champion of the brand. And for several months, this has been the topic of conversation. And now that we're starting to implement these social initiatives, putting the word out and working as a team to be better with the business organization on all levels, we will start the, as Amy put it best, the implementation process and boots on the ground, getting everybody out there and doing it. So I think your
Yeah.
questions are important.
Yeah, you have all gone through something that you've never gone through before as caregivers, okay? And as partners to your colleagues during this time. This is, one of the things that we should also think about is exactly what you said. Is there a different way we need to care for each other right now because of what's happened?
Mhm.
I have a good friend, actually a guy who runs Fairview Hospital now, Neil Smith, great guy, okay? He said that healthcare is very good at a sprint and horrible at a marathon.
Ooh.
And
Well said.
it's really, you know what, it's really true. But we just need to be cognizant of that. That's the way people are built that are in this business. And when they get to the marathon, that's when I think the quote burnout starts to happen and all of that. And are we taking care of them? It's you only take care of patients if you got a staff that will do it and can do it. And so it's a great two-way street.
Agreed.
So I'd be happy to meet with you, Courtney. I don't from a board perspective, personally, I provide oversight, not management. I certainly have managed organizations, so it's so easy to slide between the right role that you should be playing. And I would just talk to Lisa about it and say, hey, let's. I'd be happy to talk to you all about it, but I just think this is it's a moment in time where our patients are going to display differently, our caregivers are going to display differently, and the stress. If you just think of the problems you all have had with exposure, not a lot of knowledge about this disease when it happened, but very scary and very frightening. That goes on, and it's very confusing because care processes that I know have been altered and changed and were so difficult at the beginning. Getting a little better now when somebody's in the hospital, I think, or somebody needs care. But and then you throw on it this whole piece of social justice that I think is in all our minds. How do we be better at that? And maybe that's the blessing from this, that we were able to pause a little and say, hold it, this doesn't work. But I think it's within all of us, or many of us right now. And so we've got to acknowledge where are people? Not where do we think they are, or where do we, are they there? What's going on? And that's the only way you can help a patient, or you can help a staff member. But it's,
right.
I always used to say this, and I'll share it with you. I did this in orientation, by the way, which I think is a underused event from a business point of view. I would ask folks, who's your most important customer? And tell me about that. They'd answer, kind of very thoughtfully, the community or a doctor, blah, 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 blah. The most important customers are the people you work with. And if you don't take care of each other, you can't take care of patients. It's a time where we can elevate that to much more than just talk. So that's enough for today. Thank you for listening. And thanks for your work. That's the other thing. I mean, you know what? You talk about people in the hospital. Okay, well, we know the environment, at least we're going to work in. So there's a level of, quote, safeness no matter what's going on. In the home is like, are you kidding me? It's like throwing dice against the wall. And they don't know, and they're not trying to hurt us. It's just frightening. And I think everybody's been through that and worried about their friends or their family or themselves getting this crazy disease, which I hope is going away. I have some fear that it's going to, kind of be around a little while in some form. And I think the other one that you've all talked about is, what about people that have this long term? What in the world, is that an illness or disease that we're going to be treating in the home? I think so. And what does that mean to us? So I think there's just a lot that is in the mix right now, and it's all healthy things to try to deal with. And hopefully just forward thinking, not like we should have done this and we should, you can't do that. It's done. If sometimes in our life, if we could get rid of the rear view mirror, I think our life would be a lot better. We look at it a lot, I'm afraid. Anyway, thank you all. Thanks for what you're doing. I really
completely
appreciate
agree.
it.
And I can brag on these two women because they're the ones doing the real work, and I'm here learning and helping and sharing that and their gift with everyone. One thing I would really like to share with you is that a few months back, we asked each of our directors to make a promise to their staff in their department. And when I read Amy's, before I had met her, it brought me to tears because, well, everyone was doing such a great job of making promises to help support their mission and the company growth. Amy said, Amy, do you remember? Because it stayed with me and it will forever. Amy said, I promise to be here for you.
Mhm.
When you need support, come to me. When you need help, come to me. And I promise to serve you first. And that was, and coming from our director of mental health, she is
Beautiful.
the epitome. She is living and breathing this. It is, for all of us in healthcare, it's more than just a job, right?
Oh, yeah.
And
No question.
I can say the same thing for sweet Tara. When she would go, I got to visit a patient with Tara not too long ago, and they always tease her because I'm just doing my job. I'm just doing my job. And while that was the big joke, I asked Tara an interview question in front of them, which brought everyone to tears. And I said, "Oh, you're just doing your job?" And we all laughed because, especially in mental health, for me, it's been crystal clear how forward thinking this group is, how much they do care for each other. And I believe that they do take care of each other. And now expanding to others outside of mental health, working to take care of and support as well. And me being new-ish to this role is promising because I don't have a rear view mirror to look in. So what we talk about is how we will be better together and how we'll care together moving forward. And I see lots of great things. So
Yeah. Good luck to you on this. Yeah. God bless you and all of you. It's there's a really easy thing to emulate. It's another thing that I put into that setting I just talked about. I asked folks to think about what's the best place you worked. It could be because of a big organization, a department, okay, but normally it's a new organization. And I can tell you, people didn't talk about parking. They didn't talk about equipment or the IT system. Best place I worked was where people cared about me all the time. And if that doesn't happen, you'll never get there. So I think it's a great goal to keep in mind as you're leading folks. You can make a huge difference in their life, and that's a duty. And I agree with you. I came into this because it just absolutely startled me when I started to do some legal work inside a hospital and got to see, candidly, all of you and what the work really is and how much it's a ministry compared to other things. And that's actually why I got into healthcare as a leader, et cetera, et cetera. But just think about creating the best place you ever worked, and the organization will be in good hands. So all tied to this. But know you're appreciated. The first thing I will tell you that. Know you are appreciated and valued.
Thanks.
And know that the organization I'm going to speak as an administrator from the old days, candidly, we'll always screw up. Just tell us, okay? And if people aren't listening, they need a 2x4 somewhere. Anyway, but they will, because they're not close enough to the action. They never can be. I never could go in an operating room, if you know what I'm saying. Or I could go to a room, but I wouldn't be at the bedside like you are. Very, very different. And that's that's the beauty of this business. You know, we're taking care of people in a moment in time that their to-do list kind of goes out the window, and it's you and them. So take care of yourselves, though. Okay.
Woo!
Thank you.
Thank you.
That feedback just gave me feelings all over my
Right.
body. That
All
was,
the feels, Courtney, all the feels.
yes.
Yeah. Yeah.
Thank you for sharing all of that. Oh, that is
Sure. Enjoy the moment, guys. Okay.
incredible.
All right. Talk to Lisa, and we maybe get together for a few minutes sometime. Okay. I'd love to do that. Okay.
Thank you so
All
much.
right.
Thank you.
Okay.
Take care.
Thank you. Have a great day. Better day than you thought.
Bye.
Yes, thank
Take
you.
care. Bye-bye.
Ladies,
Bye.
God bless.
how can our listeners, how can patients best contact you or be in touch through our mental health program? Email, direct them to the website. What's the best way for people to be in touch?
Oh, call Amy. She's got tons of free time,
A direct referral. for God's sake.
right? Just
Please,
call Amy.
please.
No offense. You know,
Call
go to our
216.
website and you'll get some information.
Yeah.
That's like,
Yeah.
you know, it's probably down on the bottom in low, you know, font. Contact us. That means you don't want to be contacted. Oh, by the way, and that you want the website to work as the intermediary. I kind of don't like the intermediary when it's technical. But anyway, I would do a direct referral. I got to roll, folks. Thank you very much. I'm going to jump off.
Thank you.
Bye.
Bye. Yes, please reach out to me. My phone number is 216-315-0836. My email is asilba@vnaohio.org. You can text me. My voicemail is confidential. I'm happy to, if we can't help you, I'm happy to link you to somebody who can and offer you support.
And you guys can call me too. It's my number is 216-318-0865. And my email is tbrown@vnaohio.org.
Thank you everyone so much for joining us today. If you want to reach out for additional support or resources, you have Tara's number, you have Amy's number. You can find us on social media. I'm behind each of our platforms. So if you send a direct message to any of our social sites, you're communicating with me directly. And everyone here is here to support you and help you through it, whether it's you or for a loved one. So the important thing is to know that you're not alone. And if you are uncomfortable with the way that you're living, feeling, and thinking, there are options for you. And with this incredible team we've got, we can help you improve your quality of life. Amy, Tara, thank you so much.
Thank you.
We have,
Thank you, my pleasure.
Yes, it gets better. So we've got some more of these coming up, and I look forward to discussing our next topic. What do we have on the agenda for the next one? Do you ladies remember?
It's talking about anxiety disorders
Anxiety disorders.
in more detail.
Absolutely.
Mhm.
That'll be a great one to discuss because of now and always, to bring light to anxiety and how we can all cope and find relief as well. Thank you, everyone. Have a wonderful day. Thank you, Amy.
Have a great
Bye.
day.
Thank you.
Thank you.
Thank you.